Thank you, Ali and David, very, very much, both for the invitation to be here, but also for that introduction. I'll just check. I think with the microphone you can probably all hear me properly at the back. It's always a risky moment saying that, and I've always been cautious ever since the time I did say that, and someone at the back piped up saying, yes, but I'm happy to swap with someone who can't. And can I, whilst on the subject of thank yous, thank you, Chris, for everything you do, both with Revolving Doors, but also more broadly with the Ministry of Justice, the advice, the support, the critical challenge you give us, and the expertise you bring to all those discussions. We and the country and the policies we enact are the better for your experience, so thank you. And it is a very real pleasure to be here speaking at the Revolving Doors Agency's 25th anniversary. So I suppose I should start by saying a very, very happy birthday to you. Now, the range of work that Revolving Doors has undertaken since 1993, from creating services that fit user needs to working with officials and society to drive real change, not just about policies, but about change that transforms lives, is truly impressive and something that I believe you should all be incredibly proud of. And I'm delighted to be here this evening to highlight the work that we in government are doing alongside you and many others, and to look forward to what more can be achieved. Now, before the Revolving Doors Agency started in 1993, I think it's fair to say that the term revolving doors was barely known, and certainly not in this context in society as a whole. And I have to say the idea of the revolving door is now very much mainstream in debate in this area. And that in very large part is down to your great work and its help to share and drive debate and thought in this area. So thank you very, very much for that. Now, I believe the work of the Revolving Doors Agency and that of other organisations, through that we have a much better understanding of the multiple needs and vulnerabilities of those who come into contact with the justice system, of the root causes that led them there, and how to escape them, how to help them escape the revolving door. It is about mixing research and rigorous research with genuine lived experience, and that combination is incredibly powerful. Now, earlier when I came in, I had the privilege of meeting Darren, who was talking to me about lived experience. And we were talking about a story which I think is hugely powerful, and many of you may know it, but it's about someone walking down a road and you see someone in a hole, standing at the bottom, can't get out, and various people are going by and saying, oh, put a ladder down, put a rope down, and this person at the bottom of the hole simply can't get out. And then someone goes past and they jump down into the hole, and he says, what on earth are you doing? Now there's two of us stuck down here. And this is the key. That person says, yeah, but I've been here before and I know the way out. And that is what is so important about lived experience and peer support. And that is one of the things that makes the work you are doing so important and so powerful. Now, in his first speech on prisons and criminal justice as Secretary of State, my boss, David Gork, set out what he saw as the purpose of prison. To protect the public, yes, to punish, and so by doing that to deter in some cases, and to rehabilitate. I too am clear that sending individuals to prison where the offence justifies it must be a part of our criminal justice system. But where that happens, they should leave with prison having been a turning point in their lives, a turning point that will lead to a better future for them and to society as a whole. Successful rehabilitation depends on dealing with many different challenges and support needs. A key one of those needs is supporting the physical and mental health and well-being of all those in our custody and in our care. And only by doing that will we deliver on that vital third purpose of prison, rehabilitation. And indeed, only by doing that and delivering on rehabilitation and reducing reoffending do we actually deliver on the first and actually genuinely protect society and mean there are fewer victims within our society. addressing those needs effectively in the community is also key if we are both to support prisoners on release and, most importantly, divert some of those most vulnerable offenders away from custody altogether, halting that revolving door. Now, for many individuals, poor health often drives their needs and vulnerabilities. As you will all be very well aware, offenders typically have more prevalent and more complex physical and mental health needs than the general population. And as the Minister with responsibility for offender health, that is something I am determined to address. Clearly, addressing offender health needs is not something which the Ministry of Justice can or should deliver in isolation. While there is much the Ministry of Justice and HMPPS can and indeed are doing to support improved health outcomes for offenders, we can't succeed alone. And that's why in April 2018, the Ministry of Justice, Department for Health and Social Care, NHS England, Prison and Probation Service and Public Health England published a national partnership agreement confirming our shared commitment across justice and health partners to work together to deliver safe, legal, decent and effective healthcare for all offenders. It's a significant milestone, setting out a joined-up strategic approach which is absolutely crucial given the often complex nature of offender health needs, and it builds on our shared commitment to develop a proper health and justice pathway. This partnership working is essential at all points through the criminal justice system and indeed more widely across all aspects of government. Now, for some, obviously, prison isn't the right course for them or for society. And I am delighted with the ongoing expansion of NHS England's liaison and diversion services, which I know you at Revolving Doors have supported and championed from its very inception. By placing clinical staff at police stations and courts to provide assessments and referrals to treatment and support, these services are successfully diverting vulnerable offenders away from custody and in many cases away from the criminal justice system altogether. Take, for example, Dee, who was arrested for an alcohol-related offence. This is how she describes her interaction with liaison and diversion services. The service helped me when I had hit an all-time low. They were professional, yet approachable, and I really felt they were on my side and understood the place I was in. The practitioners are a credit to the service. They prepared the court report, which enabled the district judge to understand the pressures and strains I was under. Due to their help, the case was dismissed, and I was able to leave with a clean record. Without their assistance and support, I doubt this would have been the case. I continue to get support from the local women's centre and have finally attempted to address issues from my past. That's a very, very powerful story, and there are many, many more like that. Now, I understand liaison and diversion services should be rolled out in full across England by 2020-2021. And I am immensely grateful to everyone at the Revolving Doors Agency who supported the co-writing of the service specification for liaison and diversion services, and I know how tricky and complex such things can be, and for their support and design of the peer support pilots in Birmingham and Wiltshire. And it's fantastic, as I alluded to earlier, to hear that peer supporters are engaging people who have previously refused support. It shows once again the importance of setting lived experience at the heart of decision making and helping people out of that hole in which they sometimes find themselves. Now, while a custodial sentence must always be available to a judge where the seriousness of the crime justifies it, for those who do receive a sentence, there is persuasive evidence, as many of you in this audience are no doubt aware, that short custodial sentences are simply often not effective in terms of rehabilitation. And I have to pay tribute again to Revolving Doors for your tireless campaigning on this, and as we were next door, I saw the infographic and the timeline, which shows just what you've achieved in campaigning on this. The reoffending rate of offenders serving less than 12 months is about 65%. But the reoffending rate for similar offenders who receive a community penalty has been shown to be much lower. Short sentences can generate churn, which is the major driver of instability in our prisons, and they simply do not provide sufficient time for proper rehabilitative activity where staff can actually get to know the individual. At the same time, we know that providing appropriate treatment and support for offenders in the community can work. In October 2017, experimental statistics from MOJ and Public Health England data report on the impact of community-based drug and alcohol treatment on reoffending found that amongst those who committed an offence in the 2 years prior to engaging in alcohol treatment, 59% did not go on to reoffend in the 2 years following that support and that treatment. Another MOJ study found that when offenders were with identified mental health issues were given a mental health treatment requirement as part of a community order or suspended sentence order, they were significantly less likely to reoffend compared with similar cases which did not include that requirement. That is why we have worked with the Department of Health and Social Care, NHS England and Public Health England to develop a community sentence treatment requirement programme which aims to increase the number of community sentences with mental health, drug and alcohol treatment requirements attached. The programme is currently being tested in courts across 5 areas in England and dictates a new minimum standard of service with additional training for staff to improve collaboration between the agencies involved. All of which is helping increase confidence among sentencers to use CSTRs. The fundamental and core aim of that programme is to tackle the root cause of an individual's criminality, and I hope that, where appropriate, this initiative will help divert some of our most vulnerable offenders away from custody. Offenders, for example, like Bob. Bob was charged with assault and had a previous lengthy history with the criminal justice system. After a mental health assessment in court, he agreed to consent to an MHTR and an alcohol treatment requirement. Bob was difficult to engage at first, but benefited from values-led work and sessions on topics such as the importance of sleep. The court is very pleased with his progress and have now agreed no further reviews are necessary. Bob has returned to work and feels confident in his ability to use techniques he has learnt should those problems recur. Now, in particular, we know that custody can be damaging for women. Over 3/4 of women sentenced to custody receive sentences of under 12 months. But female prisoners are more than twice as likely as male prisoners to report needing help for mental health problems, and their rates of self-harm are nearly 5 times higher than those for men. In addition, more female offenders are primary carers than their male counterparts, leading to a disproportionate impact on children and families and a potential failure to halt the intergenerational cycle of reoffending. Now, in June, as you'll know, we published our Female Offenders Strategy. It sets out our plans to improve outcomes for women in the community and custody. The strategy commits the government to a new programme of work, driven by a vision to see fewer women coming into the criminal justice system in the first place, fewer women in custody, and better conditions for those who are sentenced to custody. This strategy represents a shift in focus from short custodial sentences to community interventions, which provide better opportunities for complex needs to be addressed and are more effective in reducing reoffending. We want to improve community-based provision for women so that sentencers ensure that women receive the holistic support they need and divert women out of short custodial sentences where appropriate. And that is why we are investing £5 million of cross-government funding over 2 years in community provision for women. This will support the development of multi-agency, whole-system approaches and also community services working with female offenders such as women's centres who do an amazing job day in, day out in this country. We have committed to working with local and national partners to develop a pilot for residential women's centres in at least 5 sites across England and Wales, and we want to develop a robust evidence base about what could be effective, sustainable and scalable models for improving outcomes for female offenders and reducing the numbers of those women on short custodial sentences. And while that is a hugely important part of this strategy and is one that understandably has attracted a lot of media attention, I would encourage everyone to look at that strategy as a whole, because that is important, but there are a huge range of other measures and steps in there which across the system will help address these challenges. Now, a high proportion of women in custody will have experienced some degree of trauma during their lives, and that is why we are committed to developing an approach that is informed by that experience and recognises its links with offending behaviour. For example, one small thing, a charity that champions trauma-informed practice with criminalised women delivers Becoming Trauma-Informed training. This training now covers all senior management teams in the women's custodial estate, with prisons continuing to embed this approach and train staff across all grades. I believe there is much we can learn from this tailored approach across the wider estate. And your upcoming report on adverse childhood experiences and links to the revolving door will, I'm sure, as always, be an important and significant contribution to that debate. Now, where custody is the appropriate option, I want to ensure that the men and women in prison have positive health outcomes and the genuine opportunity for rehabilitation. I'm proud to outline some of the work that I believe is getting us closer to tackling the revolving door head-on for someone walking through the prison gate. Last week on World Mental Health Day, the Prime Minister announced the government's new campaign to train 1 million people in mental health awareness. Every mind matters. This is testament to both this government's and her personal commitment to challenge the stigma that people with mental health, ill health still often face, and giving them the support that they need and deserve. And rightly at the Ministry of Justice, we are playing our part in ensuring that the right support is in place for all those who need it, including those within the criminal justice system. A Ministry of Justice study of adult offenders sentenced to prison in 2005-2006 found that nearly half of prisoners were at risk of suffering from anxiety and or depression, approximately 3 times the figure in the general population. And in the 12 months to March 2018, up 16% from the previous year, there were over 46,000 reported incidents of self-harm. And in the 12 months to June 2018, there were 77 self-inflicted deaths in custody. Down from 99 in the previous year, but still all too high, and every single one of them a tragedy. So what are we doing to address these figures and give offenders the support they need to rehabilitate? For all offenders, not just those with acute needs, an informed, responsive workforce is crucial. That's why we're investing £100 million to boost staffing on the front line, to improve prison regimes and enhance access to healthcare. The department has achieved its target to recruit 2,500 additional prison officers 7 months ahead of schedule, and between October 2016 and June this year, we actually recruited over 3,650 frontline prison officers, and this number continues to rise. What this means is we can implement the key worker role to build more constructive relationships with prisoners, including supporting them to make positive health choices and attend healthcare appointments. Anecdotal evidence indicates the new model is having a positive impact already. And I'm extremely hopeful that this will contribute to our other measures to bring down the horrifying numbers of self-inflicted deaths and self-harm incidents. And I'm immensely grateful, and I want to take this opportunity to say it, immensely grateful for the dedication of our prison staff and all who work in our custodial estate for their commitment in achieving this. We're also training prison staff in key areas such as mental health and substance misuse. We know the first few weeks in custody are the highest risk period, which is why we have provided specialist suicide and self-harm prevention training for over 17,000 new and existing staff to help them identify, monitor and support vulnerable offenders. Through our prison estate transformation programme, we're also getting the basics right by building decent prisons designed to improve rehabilitation and create safe and secure environments for both staff and offenders. We will reconfigure the estate to ensure prisoners are held in security conditions proportionate to their risk and enable governors to better target resources to meet their needs. Our prison estate reforms will also benefit prisoners with health concerns by delivering prisons that are more safe and secure so our staff can work more closely with offenders to change their lives and turn their backs on crime for good. Within the prison walls, we know that undertaking physical activity and sporting activities offer both physical benefits and improve mental health and a greater sense of self-esteem. A wide range of sporting opportunities are available to prisoners, including football, rugby, basketball and weight training, among many others. And in addition to this work, Parkrun have recently established 6 parkrun events in prisons. This is something in prison not only offers prisoners and staff the opportunity to take part each Saturday morning in the run, it also offers the opportunity for prisoners and staff to volunteer to help run the event, much like the events we see in our towns and villages up and down the country. And I hope to see even more initiatives like this taking place across the estate. And in that context, I'm very grateful to Professor Rosie Meeks for her recent review of the value of sport in prisons. For offenders with serious mental health needs, the Offender Personality Disorder Pathway Programme, or OPD, is a real success story. As I set out earlier, close working with our health partners is essential to ensuring offenders get the healthcare they need, and the OPD pathway is a great exemplar of what HM, PPS and NHS England can achieve when we work closely together. The OPD pathway is a joint programme between HM, PPS and NHS England, and since 2012 has provided a significant contribution to the management of high-risk offenders with complex presentations likely to be diagnosed as personality disorder. And joint initiatives like this pathway demonstrate what can actually be achieved for some of our most vulnerable offenders. And finally, you will have all seen the devastating impact of psychoactive substances like spice and what they are doing in our prisons alongside wider substance misuse. We have formed a drugs task force working closely with law enforcement and health partners across government to restrict supply, reduce demand and build recovery. That task force is developing a national drug strategy underpinned by advice and guidance that will support the whole of the estate, which will be issued to prisons in the autumn. Our drugs task force is also working with 10 of the most challenging prisons to understand their situation. We will invest £6 million on tackling drugs in these establishments, enhancing physical security and investing in more staff focused on effective searching, drug detection dogs, body scanners and improved perimeter defences. And in July, the Ministry of Justice and the Department of Health and Social Care announced a £9 million drug recovery prison pilot at HMP Home House to deliver a whole prison approach to tackle the supply of drugs into prison and create an environment where prisoners have access to the full range of health services to meet their individual needs. A key element of that pilot is to provide support to prisoners on release from prison to help the transition process from custody to community through connecting community teams based at the prison, and a vital aspect if we are really to see an end to the revolving door. Take R, who was sentenced to 4 years for armed robbery. He has a long history of substance use, with his primary substance abused being heroin. The Connecting Communities team helped support R with his initial probation appointments, access appropriate medication and support from his local treatment service, and attend regular appointments with his key worker in the community. He's been out in the community for some time now and is very thankful for the support he received. He now feels empowered to move forward in his recovery, and it is that sense of personal empowerment which is so important. The transition from custody to community is a crucial one. Last month, we concluded a public consultation on proposals to improve both the structure and content of probation services. And indeed, I believe staff at Revolving Doors led a fruitful session with our probation programme on a recent away day, and again, I'm very, very grateful to you for that. We are determined to build and learn from what has worked as well as what hasn't, and to better support probation staff who have a key role to play in reducing reoffending and protecting the public. I'm very pleased that for the first time since July 2017, GP practices are required to accept pre-registration by prisoners coming to the end of their sentence. And once implemented, I'm confident this will support rehabilitation by helping to prevent a break in access to necessary and valuable treatments. Now, where offenders should not be entering custody, I am clear that routes like NHS England's liaison and diversion services and our CSTR programme offer valuable opportunities to end the revolving door once and for all. Where individuals do enter custody, it is imperative that they too benefit from valuable health interventions, and that the Ministry of Justice, the Prison and Probation Service and health partners work together to drive improvements. Increased staffing levels, improving the prison environment, and a focus on drug recovery are all key aspects which I believe will help us reach this position. I am hugely optimistic about what can be achieved, and central to that will be a continued and genuine partnership with all those organisations, government, private sector, organisations like Revolving Doors, charitable trusts, and those who have expertise, and perhaps most importantly, with those who've been through the system and climbed out of that hole. If we listen and work closely with all of those, I believe we will find effective long-term solutions and make that vision in our hearts a reality on our streets and in our communities. And all that leaves me to say is a final, very personal thank you once again for the support you have offered to us and to many, many thousands of individuals over the year, and a very, very happy and well-deserved birthday. Thank you.